Hi, I'm Nic Tran, and I am a clinical pharmacist here at Premera Blue Cross. Today, I'm going to answer some questions about a hot-button topic that's been sweeping the media these days, GLP-1s, but more commonly known by names like Ozempic and Wegovy. So, do I get to interact with the box now? Okay, awesome. All right, first one. What are GLP-1s? It's a great question. GLP-1s are medications that mimic a naturally occurring hormone. Some, like Ozempic, are prescribed to people with type 2 diabetes to lower their blood sugar. Others, like Wegovy, are prescribed for weight loss. Both Ozempic and Wegovy are made by the same company, and they are very similar. But they were studied for different purposes and therefore are prescribed differently. All right, let's do the next one. All right, why do I keep hearing about Wegovy and Ozempic? What's the deal? It's a good question. Yeah, so the reason why they're all over the news is because they're very, very effective at weight loss. Users of GLP-1s see an average decrease in their body weight of about 15% relatively quickly. But it's important to know that when GLP-1s are used for weight loss, they need to be combined with diet and physical activity. Okay, let's do another. If Ozempic and Wegovy are basically the same drug, why would an insurance company cover one and not the other? Yeah, this is a great question. I get this all the time. It comes down to what your doctor prescribed and what's being treated. If you were prescribed Ozempic for type 2 diabetes, it'll be approved if necessary. If you're prescribed Wegovy for weight loss and your health plan covers weight loss medications, then Wegovy will be approved if you meet certain medical criteria. Ultimately, two drugs are approved for different purposes. All right. Why can an insurance company reject a prescription of Wegovy or Ozempic when it was prescribed for weight loss by an actual doctor? Yeah, so a health plan will reject coverage of any medication when its use falls beyond what the FDA has approved. Ozempic will most likely be rejected if you don't have type 2 diabetes, and Wegovy will most likely be rejected if weight loss medication coverage is not included in your plan. Some providers have been prescribing these drugs interchangeably. Okay, let's do another. If my provider prescribes Ozempic to me for weight loss and I don't have type 2 diabetes, is it okay to take it? Yeah, it's a good question. Some providers might prescribe Ozempic for weight loss since it has the same active ingredient as Wegovy. However, even though your provider gave you this prescription, Ozempic is not for weight loss and therefore it probably won't be covered. Okay, hey, last one. Should I take Wegovy for weight loss if my insurance doesn't cover it? Well, GLP-1 drugs like Wegovy are very expensive. The annual cost for GLP-1 treatment is upwards of $20,000. If your provider prescribes one of these drugs and you don't have coverage, then you'd have to pay out of pocket for the medication. If you can afford it, it's up to you. So, if you have any further questions about GLP-1s like Wegovy or Ozempic, please reach out to your provider. Is that it?
Yep, that's a wrap. Great job.
Sweet, thanks.